Hello, ladies, and welcome to today's podcast episode of Autoimmune Rehab. So today I'm really excited because I have with me Kim, who is a stretch mobility coach. I think that's what you call yourself.
Mm-hmm.
Okay,
Yep.
so why don't you start out, Kim, by going ahead and introducing yourself and telling us a little bit about who you are.
Absolutely. Thank you so much for the opportunity to be on the show and to share what we have to offer to so many people that are listening in. I appreciate it.
Sure, absolutely.
Stretch mobility coach is actually a licensed rehab professional, and that designation is PT, PTA, OT, OTA, or athletic trainer. And I founded the method. My name is Kim Narker, and I found it. It's been trademarked, it's registered, and it actually has physical therapy techniques in the actual registration, but it's the method, which is the stretch method, which is not just the techniques, it's the entire program that actually is a preventative and wellness model that bridges that gap in the healthcare system that people are looking for.
That's amazing. So how did you come up with that? I know part of your background is that you were a full-on physical therapist before you created this method. What I guess led you to create the method, or how did you come up with it? Let's put it that way.
Yeah. So I am actually a physical therapist. I'm an assistant. I'm not a PT, but I own a physical therapy clinic in Westchester, Ohio, and it is an orthopedic physical therapy and wellness clinic. And in that clinic, I have hired and trained physical therapists, physical therapist assistants, personal trainers, and licensed massage therapists to be able to offer specialized treatments that are more holistic than your traditional PT model offers. And next May, I will be in business 10 years. And in that 10 years, I have spoken to every one of the clients that have come into the clinic in an effort to learn more about what they're actually looking for, and found out probably within the first year and a half that the traditional PT component of the outpatient clinic that I offered was not what they were looking for. It was the wellness component combined with the PT. And then, so with seeing that, I put my method together, and the method is actually based on my PT that was working for me and still works for me, but she also has a business of her own, is a certified manual therapist. So she is a PT, but then took a program post PT school to become a certified manual therapist. And her techniques that she showed me, I was able to take those techniques and put them in a sequence that was able to provide a results-driven treatment program. Now, I have a systematic brain, so when I see something time and time again, and I put it into action, then I look into improving that. So my clinic started as a back pain and sciatica clinic. So with her treatments and the way that I could put those together to get a result from someone who had arthritis, degenerative disc disease, or stenosis, we actually found that with that combination, we could actually get relief for someone that had stenosis within 12 visits.
Wow.
So, and that means that person couldn't stand up greater than 5 minutes at a time. And the PTs in our area would tell a client, you just have to go for surgery. So we expanded into the cervical region, and now we're all over the body. So in 2020, I actually stepped away and said, you know what, something in my gut says that people are not necessarily looking for PT services, and I own a PT clinic. So I'm going to let my PTs do the PT. I am going to call myself a stretch mobility coach. And from now on, I'm not training my PTs on the method. They can just, what they come to me with during hiring is what the PT people will get. They will get true PT that's just like any other PT. I'm going to call myself a stretch mobility coach, and I am going to take the method that I use, the systematic way that we use it, and I'm going to provide stretch mobility coach services. And in 2 weeks, my schedule was full.
Wow, that's amazing.
I was blown away and went out to my office manager and said, where did these people come from? What happened? And she goes, Kim, it was just, me just saying stretch mobility. People were seriously not looking for PT.
Yeah. So do you find in general, are most of your patients that come to you, have they had surgery already, or are they trying to avoid surgery? What kind of situation in their life are they at usually?
So we have found in just the 2 years that we've been doing this program that we have all ages. So we do have people that go and have surgery and then come in and say, I've been cleared from my surgery and now I never, ever want to have surgery again. Please help me. Or we get people that come in and say, I won't let a surgeon touch me with a 10-foot pole. And there have been actually a couple people we've had to say, you've let it go too far. You have to go in for surgery, but right after you get, finished with your rehab, come back in and we'll make sure that we get you to where you need to go, because when things are broken, something has to be fixed. We have kids now. We have clients with Parkinson's. We have clients coming in that they're going through cancer treatment and they still need flexibility, but they need someone skilled. Osteoporosis. We see so many different types of people. It would blow your mind.
Wow, that's amazing. And I know you addressed a little bit of it. So, but I'm assuming, the difference between like the PT and the stretch. So I know with the PT, it's more of, the therapist is there and they're usually trying to make you do these exercises, and they're making you do things like grab a rope and move around stuff and making you stand up and, do the bike and all of this kind of stuff. With the mobility stretch, I'm assuming it's more of like a method where you're assisting the patient in actually stretching. Is that a correct assumption, or is there a little bit more to it than that?
There is a lot more to that.
Okay.
Than that. So here's how I'll explain it. So physical therapy and what we're taught in school and what we provide to a customer through insurance-based care is what an insurance company will reimburse you for, is a reactive care system. And what that means is someone comes in with pain or an injury, and we get to provide care to get them out of pain. The problem with that model is that once the pain is gone, if you do not fix the problem behind why the pain occurred, you're not doing anything but kind of sugarcoating and giving a short-term benefit to a person in pain. And what we find is each year, those clients come back in to see us, and in the therapy department, we just kind of go, they're non-compliant. It's their fault, right? It's not our fault. It's their fault that they keep coming back. I looked at that and went, wait a second. It doesn't sound like to me it's their fault. It sounds like to me, as a therapist, we may not have the skill to do anything more than get them out of pain. Now we need to learn how to listen to a consumer and build a program that walks them through past the pain to where we get to the root cause and to where we can then prevent it from coming back and keep people away from surgeries. That's the area that we work in. So an analogy I use is traditional PT is like a firefighter. Your house catches on fire and the firefighter puts the fire out. But what are you left with when the fire is out?
Yeah, house that's all burned up and got a lot of damage. Yeah.
So now you can't live in that house.
Yeah.
So, a way for people to look at what we do is we take that person who is experiencing pain and or tightness through a program that decreases that pain or tightness, figures out the root cause of the problem. And then we not only work on that and that's hands-on techniques. We're testing them and we're providing a hand-on technique that is our specialized techniques that includes physical therapy principles. We improve mobility, and then we improve stability, the deep stability where those muscles were not functioning anymore or they were compensating. And then we take that person from that point and we provide them with exercises that refire muscles that have been shut off. And we challenge the person with every treatment and move them up so that we have a combination of us gaining the mobility through our hands-on techniques, the client doing some exercises to refire muscles, and then we give about a 10 or 15 minute home exercise program for them to do at home.
Okay.
So that they maintain their results in between sessions. So typically for our clients, no matter what they come in for, they will see results in the very first visit.
Wow.
They will actually feel different in 3 visits. And then between 6 and 12 visits, they will see major improvement.
Wow, that's amazing. Because I know from my own experience, and I mentioned to Kim for a little bit as we were talking before we started recording, I actually had surgery on both of my knees this March. And then I went and did 6 weeks of physical therapy after my knee surgery. And I was still in a ton of pain. Like the physical therapy didn't really even fix my pain. It basically just made it so that I could actually move a little bit better. And the mobility factor, because I mean, there were some things when I went to physical therapy, they tried to make me do, and I couldn't even do them because I was still in so much pain. And it was like, yeah. So I'm thinking, wow, this seems like this would be, a much better alternative. However, I am one of those people that I really do feel like surgery was a necessity. I'm actually gonna have to do stem cells in about a year because I was headed down the road of having to do total knee replacements. And
so what surgery did you have done, if we could ask?
It's called an orthopedic washout. So the surgeon goes in and cuts you open in both knees and they clean you out and they try to fix and repair any of your damage. And so I had pretty significant damage to my knees and was headed down the road of almost not basically having to do knee replacements on both my knees. But I was able to catch it in time that stem cells will probably fix it and I won't have to do that. But it's one of those things I almost be glad I had the pain because it warned me before it got to be too late, And
it's funny that pain, guys, is an indicator something's wrong. It's literally just a white flag for your body going, I've done everything I can, but I can no longer compensate for a problem that you need to get fixed. So it's interesting. You said the type of surgery. So knees are one of the number one things that PTs really don't look preventative at. And I'm not discounting every PT out there. I'm just saying that.
Well, and the PT that I had was actually really good. I really can't complain too loudly, but it just was not, and I definitely think it was helpful. I mean, I'm not sorry I went, I don't I don't think it was a waste of my time or money to go, but it was just not maybe as helpful as I feel like something that what you're offering is. So,
So yeah, the difference is we're going to take a person who is experiencing knee pain and we're going to look at, okay, the knee is a middle joint in between the hip and the ankle. So we have to look at the back, the hip, the knee, and the ankle. And if you can take that pressure off of the knee for where the damage is occurring, and typically it's on the inside of the knee is where it first starts.
Yep.
And if we can take that pressure off, and we usually can do that within 2 or 3 treatments for a knee. And then we have to change and work on, okay, what is causing that pressure to happen that causes that rubbing to occur? And then what arthritic damage is present Is it too much arthritis to where we have to do some regeneration? And our regeneration is a deep thermal laser. I haven't found a knee that we can't help not have surgery and not have to spend $5,000 on stem cells.
Oh, yeah, that's interesting. Yeah, mine is pretty significant arthritis damage. Yeah.
Yeah. So I've seen them to where, I mean, the one knee is much more huge than the other knee, and
That's
they don't
what
have,
happened with me too.
yeah, and they don't have the mobility. They can't keep it straight, and we can
Yep.
still get them pretty straight. We've got a guy right now that he did regenerative care. Our regenerative care for the laser is $450. So it's
Yeah.
not as much as the stem cell or surgery. And then his knee, we've probably done 4 treatments on, and he is going up and down the stairs, not holding on as much right now. So he's doing really well. And then we have another lady, and this is just recently, we have another lady that came in, and the PT told her she could not wear her heels anymore.
Mhm.
And that her knee was so bad that she had to have surgery. And she spoke with me out at an event, and she came in, and it's been 5 treatments. And she has zero knee pain and is wearing her heels without any problems.
Yeah, and see, I have almost no more pain anymore unless I walk really long distances. You know, if I try to go run a marathon, I'm sure I'm going to have some pain, but I've been able to successfully, for the time being, get rid of 90% of my pain now.
So that's good, but can you get on and off the floor?
Yep.
And pick something up,
Yep,
like
I
get down
can.
on your knees and go back
Yep,
up? Good.
I actually
Then
can.
wonderful. So what we do with people who have had surgery already is our goal then becomes, okay, let's get as much mobility as we can and as much stability as we can so that we can now prevent that knee replacement.
Yep, I actually dropped something on the floor the other day and had to get down on my knees to pick it up. And I actually couldn't even do that for probably like 3 years before the surgery. I mean, I was having knee issues for a long time before it totally escalated into major issues. And now I can do it, I mean, it's not the most comfortable thing. I don't love being on my knees for a really long period of time, like with yoga or things like that, but I can definitely do it, whereas I couldn't even do it before at all. So
That's
yeah.
awesome. That's awesome.
So yeah, it's good. But yeah, that's why I say I'm sure you are busy, busy, busy. And I know you mentioned that you're going to be opening up more locations, and I'm sure people working at those locations are going to get busy too.
Yeah, we have, so we have 3 locations. So my program, I offer an affiliate program. So any business out there, like a medical office or a chiro office or PT office or a gym that wants to offer stretch mobility coach services, they can buy in to the affiliate program and open their own business. And that affiliate is just an affiliate license. It's not a franchise. And they can open a clinic, and then I train the stretch mobility coach for them to hire in their clinic in an effort for us to spread this around the US. And currently we have 3 other businesses. One is in Canton, Ohio, besides Westchester, of course. One is Canton, Ohio. One is Pennsylvania. She's in Lehigh Valley. And then another is in Louisiana. And he's going to be opening his mobile in Baton Rouge area.
Cool, that's awesome. Well, I'll have to see if I can come up with somebody that might be interested in my area. I mean, I actually even think potentially my orthopedic might even be interested, because he's very into a lot of holistic stuff. And he actually does the stem cells himself, which is kind of amazing, because a lot of orthopedic surgeons don't do stem cells and a lot of the holistic stuff. They just do surgery.
Absolutely.
They're just like, and in fact, he doesn't even do knee replacements anymore, because his patients all get better with stem cells. He doesn't have to.
Well,
So
then
he
he
really
is a person
to really only do surgery when it's necessary. And I think in a perfect world, he'd probably rather just do other things and not do surgery. So,
I don't blame him. Yeah, so he'd be a great one to be an affiliate for it. And it's kind of like a business in a box. He just incorporated into his practice. And then we would find then a stretch mobility coach in the area and train them. And then he would hire them. And from what we're seeing, it takes probably 3 or 4 months to get them full. And then they're wanting to hire another person, depending on the area and, you know, how many people.
Yeah, so I'll have to, next time I talk to him, I'll have to just see what he thinks of it. But, you know, if it doesn't work out with him, I'm sure there's, you know, you'll eventually find somebody, because it's,
yeah,
I can see that being a really, really good thing. So yeah, I'm really glad to have had the chance to talk to you. So let me see. I think you've covered a lot of these questions I was going to ask. Let's see. So, how about this one? What do you think the very first thing is that somebody should either know or do if they're thinking about coming to you for stretching? What are some of the, I mean, it's maybe even 1 or 2 things that somebody should really know or do before they get started with doing the stretching?
So I'm going to back that up a little bit. And everybody jokes me because I say that, because again, your body, when it signals tightness or pain, and tightness is usually that first signal. You kind of get up in the morning, and if I use a low back being an area, some people will wake up in the morning and go, my back is a little stiff, but when I get moving around, it starts feeling better. That is your first sign that you probably have arthritis in the lumbar spine. And typical symptoms will be you can't walk as far, or you fatigue pretty easily, or, you know, after you do some gardening or do some things that you don't do on a daily basis, maybe you go to bed that night and you don't sleep well and you think, maybe I need to get a new bed. But what is happening is that arthritis in the back that grows, it's a bony growth, that's inflammation. It grows in between 2 vertebrae. And most of you've heard of L4 and L5.
Yep.
And so the arthritis grows in between the facet joints and the vertebrae. And there's a disc in between there and some nerves that go off on the back. So you've got 3, 2, and 1. So 4 and 5 is usually the first one that has a problem, because we stand or sit and don't decompress that area. Okay. So that's the area that has your first initial signs of arthritis, degenerative disc disease, and stenosis. So if you have tightness and it goes away, that's already your body telling you in the very beginning, I just want to tell you there's a problem here.
Well, that's good to know, because now that you're saying that, I think I've probably had arthritis in not just the knees, but the back for, I don't know, I had it for 12 years.
It totally can.
Longer than I had, you know, severe knee issues, you know.
So it's interesting you say that, because we're getting more and more people that are now going, they're going to stretch labs and zones and things like that, because they feel like, well, maybe I just need to be stretched out because I'm a little tight. And then they're coming to us and going, well, that didn't give me what I thought it was going to give me. I'm hoping you are my stopping point. And those people are not taking as many treatments as someone who comes to me who already has stenosis and has pain and can't stand for more than 5 minutes, because those people, I can quickly unlock the joints through our hands-on techniques, refire muscles, and they see much faster results. So if you have tightness and you felt that way in any of your joints, not just your back, seeking care from a stretch mobility coach can actually render benefits within maybe 5 or 6 treatments. And then they can put you on a maintenance program that's pretty inexpensive, to where then they just do some hands-on techniques once a month just to make sure things are not locking down. And then they give you a couple of little exercises that are easy to do to prevent you from having to head out for surgery.
That's awesome. I love that. So what would you say that people should do if, obviously you're looking on growing, expanding, but there's going to be a lot of people listening to this that don't have access to a stretch mobility coach at this point because, you're not everywhere yet.
Right.
Anyway. What should
Yeah.
somebody that's in a situation where they don't have access to one, what would be some of the other options that they could explore that you would think would be recommended?
So you can always, so we can do a video call, and those video calls with the stretch mobility coach will actually go through some testing things that we can do on you. And then we can prescribe what you can do on your own. Now, you don't get the hands-on stuff, but we do have many different tools in our toolkit to where you get better than what you would get if you didn't see anyone at all.
Oh, that's awesome. Yeah. So you are doing virtual to the extent that you can do virtual. Yeah. Okay. That's awesome. That's amazing. Okay. So is there anything else you want to share with us before we have you tell us how to connect with you? All that good stuff.
I would say that if you have any question, it has to do with your musculoskeletal system, whether it's stiffness, tightness, fatigue, any symptom that is a musculoskeletal symptom, then reach out to a stretch mobility coach or reach out to us and ask those questions before you head over to a surgeon, so that you can start at least getting some sort of preventative mindset going.
That's awesome. I love that. Okay. And remind us what your website is, and we will have her website. And I believe, I don't know what socials you're on, but we will have all of that stuff linked below in the description. So those of you who are listening, you can go find the description box and check those out too.
Yeah, absolutely. So the website is thestretchmobilitycoach.com. And that is our national website. If you wanted to take a look at what we do at Westchester, it's thestretchmobilitycoach.com/Beckett. We're on Instagram and Facebook as the Stretch Mobility Coach. And if you don't pull up mine, you may pull up one closer to you in those 3 areas that I said. If you happen to be a rehab professional and you're looking to become a stretch mobility coach yourself, then I have a podcast that is Rehab to Wellness Boss podcast. And then I also have a YouTube channel, and that's just talking to rehab professionals. Let's see, what else do we have? And anytime you have a question, literally, it doesn't matter where you are, you can text our office at the Beckett office. And that number is 513-874-8800. We get texts from all over the country.
Well, I bet you do. Yeah, I can see that. Well, that's amazing. Well, thanks for coming on, Kim, and thanks for sharing with us. I'm really impressed.
Well, I appreciate it. And, we're just out there to help people really get an honest opinion about what their choices are so that they can make the right decision for their care.
Yeah, awesome.